Good afternoon. My name is Hasnain Kermali. I'm the Chief Medical Officer here at St. Mary's Hospital in Waterbury, Connecticut, and I'm welcoming you to another afternoon of our Focus on Facebook Live. Each month we like to highlight one of our clinical expertise that we have here at St. Mary's Hospital and that we're able to provide for the community in Waterbury. And so I'm really excited to welcome Dr. Marta Neubauer, Medical Director of Connecticut Children's Inpatient Unit that we have right here at St. Mary's Hospital. So welcome.
Thank you. I'm excited to be here and talk about our unit.
Thank you for taking a little bit of time out of your busy schedule to do so. So we're going to talk about this partnership that we have, which I think is really, really cool. But before we get there, I wanted to get a little bit of background information about you. So tell us a little bit more about your journey to pediatric medicine.
All right. Well, so after college, I went to medical school at UConn. So I'm from Connecticut.
Great.
So
Fellow UConn alum.
Yes.
Great.
And then after medical school, I went to pediatric residency at Yale. And so always kind of staying close.
Yeah.
And then after residency, I've been here at Connecticut Children's for going on 12 years. And since that time, pediatric hospital medicine has become its own subspecialty. So kind of done some kind of extra on-the-job training for that.
Beautiful, beautiful. So is the training very different for pediatrics compared to, say, adult medicine? Mm-hmm. Because in adult medicine, the way I look at it is an 18 or a 19-year-old to, say, a 60-year-old, relatively standard physiology. But in pediatrics, you're going from babies all the way up to adults to some degree. And how has that training evolved over the period of time?
Yeah, so I think one of the things that pediatricians love to say is that kids are not little adults.
Yes.
And they truly aren't. Their physiology is different, so just kind of the way their heart pumps is just a little bit different in terms of how that works when they're just born to when they become adults. But also their development is different, and so you have to kind of take that into account. And so for all of the reasons of kind of physiology, there's many different kind of pediatric specific diseases that happen in childhood but don't really exist in adulthood. And then for the development reasons, there's a lot of specialized training that goes on and kind of little areas that you have to focus on.
Vaccine, I imagine, is one of those areas of focus.
Yes, exactly. Yeah, so, we in pediatric, there's a lot of preventive medicine, and vaccines are kind of at the top of the line in terms of preventive medicine. And so, there's a lot more vaccines in childhood than in adults, and so we have to focus on making sure to educate parents, knowing kind of when's the right time in childhood to get those vaccines. That's just kind of one great example.
Yeah. And then the other thing that struck me, because I remember looking back at my own journey into medicine, and I had wanted to go into pediatrics way back when. It's the relationship not only with the patient, but also with the parent that makes pediatrics, in my mind, a very unique and has its own set of challenges in that realm.
Yes, that is true. It's I spend more time talking with families, providing them education, reassurance, guidance than probably kids, but then there's the kind of happy byproduct of being able to interact with the kids as well. But like you said, a lot of it is kind of interacting with families, and it's really a kind of a holistic approach to caring for the child.
Yeah, because that child doesn't just have themselves that's taking care of, that they're taking care of, but there's a whole team around them, truly, that helps take care of them. parents, loved ones, etc., guardians, and so there's more to that relationship with their clinicians than just one-on-one.
Yeah, and it's probably one of my kind of top reasons for choosing pediatrics was that, parents and their caregivers sometimes will do things for their children that they wouldn't do for themselves. Mm-hmm. So, for example, stopping smoking.
Sure.
I feel like I can make more of a difference in people's lives because they'll make changes in themselves for their children, and they'll do things for their children, and so you really kind of see that effect, and it's really rewarding.
It's remarkable what you all do, because it's true, from smoking, allergens, etc. These are topics that you have to discuss, and these are changes that the child may not be able to make themselves. Mm-hmm. But that relationship that you're able to develop is remarkable. So kudos to our pediatricians that are out there. That in one way, speaking from the parent side, you're like, oh, that's going to be a tough conversation. But yet from the pediatricians navigate that remarkably well. So kudos to you all.
Thank you.
So you've been the medical director. You are the medical director here now at our Connecticut Children's Inpatient Unit here at St. Mary's Hospital. And we've been partners almost more than 10 years now. So what's been the purpose of what was the purpose for establishing the unit here at St. Mary's Hospital?
Yeah, so it was a little bit before my time. But my understanding was, there was two separate kind of pediatric units, one in Waterbury Hospital and one here at St. Mary's. And kind of it dispersed the resources, and so kind of consolidating it here at St. Mary's allowed for those kind of pediatric resources to be kind of in one area and really honed. And so with that, with the kind of consolidation of the pediatric unit to one area, it also allowed for the area to really have a unit that was as close to a children's hospital in their area as possible.
Right. And so let's talk about some of the capabilities of what that unit is able to provide, because one of the other pieces that we've been focusing in on in our emergency room is to provide care for the entire family. Mm-hmm. So that from 2 to 200 or from 9 to 99, whatever the age range we want to talk about, when families come to St. Mary's, we're going to provide them with that care. And mm-hmm. what we've focused on in the past little while is really improving our pediatric emergency room capabilities. Mm-hmm. But like you mentioned, having almost a unit or a hospital of pediatrics right here in the community is fantastic. So what are we able to provide for the community from a pediatric perspective on the unit?
Yeah, so on the unit, we really take kind of a wide gamut of things. I think our most common diagnoses are children with different varied kind of respiratory distress diagnoses. So commonly asthma exacerbations or asthma attacks, have pneumonia, RSV bronchiolitis, which was, with the surge last mm-hmm. year, there were a lot of children that needed admission for that.
Yeah.
But it goes from kind of the routine to sometimes the have more rare things like Kawasaki disease we can diagnose and treat on the unit. We've also, over the past couple years, have kind of extended our range of things that we're able to do here on the unit to include eating disorder patients, kind of medical stabilization of those patients. And so we're really trying to extend the types of patients that we can keep here so that the families are able to stay close to home.
And what kind of, when we talk about those services, are there specialty physicians or nurses that are required to be on the units to help manage that?
Yeah, so the unit is staffed by pediatric trained nurses and by pediatric advanced practice providers, and then pediatric hospital medicine physicians.
Right.
And so that's where kind of that specialized training in children with acute diseases that require hospitalization, those physicians have that training.
So when families then do come, and if their child gets admitted to the unit, unfortunately, they can rest assured that it's not like we're delivering a lower standard of care because we're out here in Waterbury. They're getting APRNs, mid-level providers, but also the physicians right here at the hospital. They're going to be seeing them similar to the ones that they would see, say, for example, if they were in Hartford at CCMC.
Exactly. And it's actually the same ones. So I work kind of here at St. Mary's, but then I also work at the Hartford Children's kind of main campus.
Sure.
And so, and all of the physicians that work here also work in Hartford. And so it's really the same care. And the nurses as well. They work here, but they also work in Hartford. So they're really, there shouldn't be any kind of difference that they can kind of see.
Beautiful. Well, I mean, that's very reassuring, I'm sure, for the community to hear that we're providing that same level of care that they can expect, that I'm sure they can come to expect from the providers up at Hartford right here in their own backyard. Mm-hmm. So how does this work? How does the unit work collaboratively with our emergency room, for example? So what can a patient expect if they arrive to our emergency room with a problem that's going to need some more help?
Mm-hmm. Yeah, so we work really closely with the pediatric emergency medicine physicians down in your emergency room, with Dr. Heldstrand being the leader there.
Yeah.
And so if a patient comes to the emergency room and is evaluated and felt that they need to be admitted, or if there's even a question of whether they need to come up to stay up on the unit, the emergency medicine physicians would call us and talk through the patient's care, and then we'd either decide that yes, they do need to, or we would even see them down in the emergency room and kind of assess them at that time. Mm-hmm. And then after kind of they're deemed that they do need to come up and be admitted, then the nurses from the emergency room are providing sign out to our pediatric nurses, and the physicians have already had that communication, and so it's kind of a seamless transition of care.
Beautiful.
We also kind of regularly meet with the pediatric emergency medicine attendings down there to make sure that kind of all the protocols and all the clinical pathways that for all the patients that we share kind of up to date, and we have kind of the most kind of efficient way of doing things.
Yeah, and that's what I love to hear, because what we're talking about is communication to enhance the patient's outcomes and the patient's care and the patient's experience while they're here at the hospital. One of the biggest challenges we always have is, even though we're in the same building, is sometimes just that communication. But not only communication, but making sure that what we're doing is to some degree standardized, mm-hmm. so that your team upstairs can rest assured that the patients downstairs are going to get on the right track right off the bat. So it's not like we're sending them down one track and then you all are bringing them back on another one. Everything is standardized. We all know if it's RSV, we're going to treat them X, Y, and Z. If it's a pneumonia, we're going to treat them A, B, and C. And it's the same A, B, and C that they're going to get regardless of where they're going. But here it's nicely and well delineated all the way up and down.
Exactly. Yeah, we share our kind of clinical pathways, our kind of guidelines for care with the emergency medicine folks, and then kind of we practice those clinical pathways, and those are our standards of care. And so whether they're in the emergency room getting their antibiotics or they're on the floor, they're getting the same kind of dosing and the same type of antibiotics that they would get anywhere.
Yeah. So how do our community pediatricians benefit from this kind of relationship? Because we were sitting down with them a little while ago with all of them together, and mm-hmm. and there seemed to be a little bit of excitement there, positive excitement.
Yeah. I think what we offer is kind of those resources and education for them, to be able to have kind of the have connections to a children's hospital close within their community. But also if they have questions about a patient that they're seeing in clinic, we are always available to consult through the phone or to offer to direct admit a patient if it's a patient that clearly doesn't need to go to the emergency room. But kind of having this area where their patients can go if they need admission is really invaluable, because a lot of patients, even though Hartford isn't that far, it's 45 minutes away, and for some of us, that's a long ways away.
Yeah, it's 45 minutes plus the traffic in and out of Hartford, particularly coming from this direction. We're dealing with that West Hartford traffic in.
Yeah.
Let alone, and unfortunately for our Waterbury market, we do have a little bit of issues with regards to diversity and inclusion, and being able to provide this really helps the community from that perspective. Those people who may not even have a car.
Exactly.
And if their child has to get transported all the way out to Hartford, how are they going to maintain that connection? It does become a difficult strain on them. So the community benefit is also present.
Exactly. Yeah. For kind of all those reasons that you said, sometimes 45 minutes is just undoable.
Yeah.
And so making sure that if possible, their children can stay on the unit. If they're at their sickest, we want to make sure that the family is able to also be able to go home and kind of get their stuff to be able to come and care for their child and be able to kind of visit freely and not have the stress of another drive and have all those extra things that come in to play.
Sure. And the other piece that I found fascinating was, because it's the same physicians and mid-levels and nurses that are up in Hartford as compared to here, that are here, if there is a situation where things are getting outside of what we're able to provide safely here, what you're able to provide safely here, it doesn't take long for you all to move the patient into Hartford and get that specialty or expertise that they need right away.
Exactly. Yeah. So if they're deteriorating, unfortunately, then we do have the resources to be able to have the transport team with respiratory therapists and ICU level nurses to be able to take them to Hartford if they need more care than we can provide here. But we also have the ability to do telehealth consults and things like that. So if they don't necessarily need to, there's other resources, but the transport team is, I think, what you're referring to, and they're great about being able to come quickly here and get a child and family if they need to go up to Hartford.
Yeah, and just hearing the telehealth as another opportunity just is great. Again, focusing on getting the patients the care that they need as quickly as possible without them having to travel a great deal away from Waterbury, which is great that we're able to continue to offer that partnership and continue to provide this for the community here.
Exactly.
Wanted to ask you, for the benefit of our community, given that we've just started school, I know my kids are back into school, running around doing all of those activities that they do. Any last words or nuggets of wisdom that we can share with the community in terms of keeping kids safe, or anything at all from your perspective?
Mm-hmm. I think as a pediatrician, I have to say, kind of wash your hands. Make sure that when kids come home from school, even if they said they washed their hands, have them wash their hands again. Mm-hmm. But then the kind of last thing that I want to just maybe put a plug in for is with kind of fall starting, that also means RSV season. And this fall, there's some exciting news in that there's now a vaccine that's going to be available for infants against RSV. And so
Great.
My nugget would be, talk to your pediatrician about it, get some more information.
Thank you so much, Dr. Neubauer. Really appreciate that, and thank you all for joining us this afternoon. Have a great day.